Hello and welcome to another edition of Health Solutions with Shawn and Janet Needham, where Team Needham discusses everything healthcare. I'm your host, Shawn Needham, along with my wonderful wife, Janet, and we are super excited to be streaming from the Team Needham Abode podcast studio and be talking about the consequences of taking birth control, specifically hormonal birth control, and we'll get more into the details of that later. But Janet, I'm going to let you start off with kind of defining what is hormonal birth control.
Well, hormonal birth control usually is not a natural hormone to our body. They're synthetic. There's many kinds out on the market, but they are usually a synthetic estrogen component. And their goal, of course, is to suppress us from becoming pregnant. But ultimately, when we use them in our body, we actually put ourselves into a menopausal state.
As you think about what hormones are designed to do, one of the things hormones are designed to do in a woman's body is to help a woman become pregnant. So birth control does just the opposite, even though a lot of people, pharmacists, doctors, do not understand that. They think that, those hormones are the same hormones their body makes up. And it's just absolutely not true. There's huge differences. And we're going to get into that today. One of the reasons we're talking about this is because we field calls on this almost daily. We will get a call from a doctor, and he or her will say, well, I've got this gal. She's 27 years old. She's, I checked her hormone levels, and her testosterone is low, her progesterone is low, and her estradiol is low. And I mean, my first thought is for a 27-year-old woman to have low hormones like that, they didn't even need to tell me they're on birth control. Right away, I ask them, are they on birth control? And they will say yes. Because you got to think about this. A 27-year-old woman should have high hormone levels, especially estrogen. Almost every woman has plenty of estrogen when they're in their 20s, unless they're on something to suppress them, like birth control pills.
Right.
So they'll go over those labs with me, tell me what their levels are, and then they'll say that they're on birth control. And the first thing I want to say is it's useless. It is useless to check your hormone levels when you're on birth control, when you're on hormonal birth control. And when I say birth control today, I'm going to mean mostly hormonal birth control, unless I say something different, because we'll also talk about some alternatives to hormonal birth control. So it's useless to check your hormones when you're on hormonal birth control. Let me give you the analogy why. Remember, Janet talked about it puts you into menopause. It suppresses your own endogenous production of hormones. So why are we checking your hormones? We know they're going to be low. It's literally a waste of time. Janet, do you want to comment on that?
I do. Well, we probably should have interjected. There are other forms of synthetic birth control pills that get really overlooked by providers because they lump them into the same category as your progesterone, and progesterone does the exact opposite. It promotes pregnancy. So those would be Depo-Provera shots. I'm gonna cough.
Yeah. So Depo-Provera is medroxyprogesterone acetate, and it was made to mimic progesterone, which progesterone is a bioidentical hormone. Bio meaning life, identical to mean what's in our body. And pharmaceutical companies made it back in the 50s to try to mimic progesterone and the benefits of progesterone, specifically in the uterus, to prevent uterine cancer. But they missed the boat because it doesn't work in the body like progesterone really does. Think about what progesterone literally means. Progestation. Pro means for or to support gestation. Medroxyprogesterone acetate or synthetic progestins like it are meant to are used for birth control. So it does not work like progesterone does. Anytime we try to make copies of something in our body, small changes of a hormone can make huge differences in the body. And, I'll just say that by, testosterone and estradiol, when you look at their chemical structure, they are very similar. Estradiol and testosterone are very similar in structure, but if you have enough testosterone, you'll be a man. So just changing a molecule like Big Pharma does and saying, well, it's close to what the body makes up, does not make it the same, because remember, these molecules are three-dimensional in structure. So they have to work in a lock and key system in proteins to turn off and turn on genes and certain things to express. They've got to fit in there just perfectly. And so if they don't, they can have huge implications in the body. So anytime we try to copy a hormone, it's just not the same as what our body makes up. And that's medroxyprogesterone acetate, or Depo-Provera. So when we talk about birth control today, hormonal birth control, we mean the Depo-Provera, we mean the Mirena IUD,
Right.
which is a synthetic progestin. Or oral birth control pills. They're all the same. Implanon. I'm trying to think of some other ones. Implanon that's put in your body.
The
and remember,
plants.
I think Implanon goes on for 5 years. I don't remember on the Mirena IUD, but I think it's a few years that it works. I mean, think about that, people. You were putting something in your body that is releasing a synthetic hormone for years at a time. That just can't be good. And it's literally taking your body and putting it into menopause. So it's literally making it so hormones. What do hormones in our body do? And when I talk about hormones, I mean sex hormones that it stops production of. So progesterone, estradiol, testosterone. It helps our bones be strong. It helps our cardiovascular system. It helps to have our skin. It helps build collagen in our skin. What else, Janet?
Our memory, our brains,
Right.
So a lot of our sleep. There's another one that's a
Yeah.
big one, our sleep. And many times we don't realize that, because we're told that, really what we're thinking of is we're just preventing pregnancy. But the problem is, if you're on them way too long, that can interfere with fertility. And then we have all these other long-term issues that will creep up over time. And so that's why we're talking about it, is because when we start having women being referred to us, we really need them off the pill before, or the birth control pill, before any labs mean anything, for benefits for them to be felt.
Yeah, it takes at least 8 weeks for the birth control pills to get out of your system and your cycles start getting regular of oral birth control pills. Yes. And with the Depo-Provera, the Implanon, and the Mirena IUD, because of the way they work, sometimes it can take years, and some women's cycles never come back to normal after they go on those drugs. There was just a recent report released within the last few days about Depo-Provera, and it's actually medroxyprogesterone acetate. It's actually been linked to brain cancer. I haven't read the details of the study. I wouldn't be surprised. Those drugs are just horrible. And I think what we've been doing for the last 60 years for women has just been, we're seeing the consequences, the health consequences later on. One of the things, kind of the joke in medicine, when it comes to women's hormones that we have is, if you have any kind of, why do women go on birth control? I guess is where I'm going. Many times it's not just for birth control reasons. It's for, cycling reasons. So you have a 17-year-old girl, and she's having cycling problems. Her cycles are irregular. Her cycles, she has PMS in her cycles. She has headaches during her cycles. She has acne during her cycles. And so if they're less than 40, the answer is, and they have any kind of cycling issues like that, they're less than 40, then the answer is birth control pills. If they're over 40, then the answer is hysterectomy. And women, if any women are watching right now, comment on that, because every time we talk about this, we tell a woman about this, like, yeah, that's exactly what they did to me. Or that's exactly what they told me. So that's why we're going through this, because it's not necessary. And some of the side effects of birth control that's in the package insert, headaches, blood clots, stroke, heart attack, which, the blood clots cause stroke, cause a heart attack, decreased libido. Well, of course it does. It decreases your testosterone production. What are some other side effects of birth control pills, Janet?
Weight gain,
right? And depression. Right. Well, imagine So what do you need, girls, women? When you go on birth control, you get depressed. Oh, they give you Prozac. Well, wait a minute. That doesn't make any sense. If this drug is causing depression, shouldn't you go off that drug? And I'm going to use an analogy more often in our podcast now. And it's not original to me. It's from Dr. Shawn Baker, author of The Carnivore Diet. And I follow him on social media. If you don't follow him, follow him. Um, he's a very rational, unlike a lot of doctors that are, follow this standard of care, which is not really quality of care. It's just what the drug companies and insurance companies decided is best for them, not really best for you. He actually thinks rationally about it. And here's the comment he gives. I'm using this comment because when a doctor calls in and say, well, should I put this person on hormones? And I'm like, well, they're on birth control pills already. So would it hurt to be on testosterone? No, it wouldn't hurt. But if these birth control pills are causing suppression of their own endogenous testosterone production, then does it make any sense to give the testosterone, or does it make more sense to go off the birth control pill? I think that's a no-brainer for me. But here's the analogy I'm going to use over and over again. And I apologize in advance because it's so simplistic and it sounds like kind of crazy or like I don't know what to call it, but it sounds silly. It's sarcastic, but it's true. So imagine this. This is from Dr. Shawn Baker. Imagine you start hitting yourself in the head with a hammer. And then, daily, you get up in the morning, you hit yourself in the head with a hammer. A few weeks later, you have headaches. So you go into the doctor. What would a typical doctor do? A typical doctor in our healthcare system today would say, oh, well, you need pain medication. You've got a headache. Let's give this medication for your headache. But what you really need to do is stop hitting yourself in the head with a hammer, right? I know this sounds silly, but it's true. And this is exactly how our healthcare system works. So if when birth control pills cause side effects, and they all do, because just by suppression of your own endogenous hormones, they're going to cause side effects, whether it's short-term or long-term for sure. So isn't the answer to stop hitting yourself in the head with a hammer? Stop taking the birth control pills. That's really the answer. The answer is, well, why are you not sleeping anymore? Well, you're not sleeping anymore because you don't have any progesterone in your body. So we're going to give you a sleeping med. Oh, and by the way, progesterone helps you to decrease your anxiety. And now you're anxious. So we're going to give you an anti-anxiety medication. Oh, and you're depressed too. So we're going to give you an antidepressant medication. And here you're on 3 different medications, all because of what the birth control pill caused. Oh, that's right. And you gained 40 pounds. So you know what? You must have an Ozempic deficiency. We need to give you this magic drug that we have for weight loss now. So you've got an Ozempic deficiency. You see where I'm going with this? And hopefully you can understand that this is a typical progression of somebody that has gone on birth control pills. Janet, what do you have to add?
Right. So if you're a young girl and you go in and migraines, easy example. You're having headaches that are cyclic, and they reach for that estrogen, which is synthetic to your body, which is the normal procedure. It's actually harmful, right? It's going to set you up for more problems because the migraine issue is an imbalance of your own hormones. So rather than throwing another estrogen at your body, what they need to do is help you with a progesterone. So the reason it's such a madness is that we keep compounding the issue by throwing something at it that isn't going to help it. And so then again, like Shawn's talking about, then we go down the road of, well, you need this drug, and I don't know, this isn't working. So if we can't keep throwing more madness at it, then you end up with a hysterectomy. So you see where we're going with this. It's like not solving the problem that you went in for. It's actually exaggerating it. And over time, it's going to make it worse. So we're saying, just don't go down that path. There's many reasons why we don't want to take estrogen before we go through menopause. I mean, sometimes it might be a little helpful in a topical area, but we don't recommend throwing estrogen at any woman prior to menopause.
And remember, when she's talking about estrogen specifically with birth control pills, it's not bioidentical
No.
estrogen. And just remember that not
All are
synthetic
equal.
hormones are not the same as bioidentical hormones. And that reminds me, if you follow us on social media, we're streaming live on Facebook, on Rumble, on YouTube, on X. If you follow us on those platforms, we are releasing a women's health series, a 10-part series on women's health. And we talk about birth control pills in there also, but we also talk about the differences. We have a specific episode on describing the hormones and describing the difference between synthetic, between natural, and between bioidentical. And it's very, very important. There's one thing that you can take away from hormones in general, and you will know more than most pharmacists and know more than most doctors, even OBGYN doctors. I'm not kidding you. Write this one down. Progesterone does not equal medroxyprogesterone acetate or Provera, which is brand name Provera, generic name medroxyprogesterone acetate. Those drugs are not equal. You know that. You will know more than most pharmacists and most doctors about hormones. They're created way differently. We talked about it earlier in this show. They have huge differences in the body. So know that. Write that down. Memorize that. They're not the same. You will read studies that put them in the same category. They are not. My 9th edition Goodman and Gilman book, a pharmacology book from pharmacy school, puts them in the same category. They are not. They are completely different. So they are not created equal. So know that thing. Know those. Another thing that what else are some things that birth control pills are prescribed for? We talked about this over and over in our podcast. PCOS.
Mm-hmm.
And PCOS is polycystic ovarian syndrome. Doesn't really always, the name does not always mean you have polycystic ovaries, but usually what it means is you're not having cycles at all or very irregular cycles. It's a metabolic problem that has caused a hormone problem. But and you don't have enough hormones, specifically progesterone, like Janet was talking about. You don't have enough progesterone, so you're not cycling normally. And what do doctors do? What's the standard of treatment, standard of care? Oh, give birth control pills, which suppresses your progesterone production. It makes it worse in the long term. And it's just horrible what we have done to women with these birth control pills. And we see women in their 50s that are still on birth control pills, or they're on some kind of hormonal birth control. They say, well, when I was a teenager, I had headaches, and the doctor said it was the best thing to stop my headaches. So for 20, 25 years, 30 years, we have suppressed their own natural production of hormones. Horrible what we have done. And what happens? Some of these women, you can see them. They're osteoporotic. They're in their 50s and have osteoporosis. Why? Because they haven't made any hormones to make their bones strong. So they're all bent over and hunched over, and they're only 40. I mean, it's crazy what we have done to women when it comes to hormonal birth control. Janet?
Well, and if we're talking long term, I can speak very personally to women who I have a close associate, and her mother is still very young, but she's going through dementia and Alzheimer's, and she's in a ward right now because the family can't take care of her because she's combative. So estrogen, which is our body makes, estradiol, has been known for a long time. I mean, we've sat through traditional classes listening to the talk about brain health and how estradiol is important for that. Well, when you're depressing that from the time you're in your early 20s to the time you go through menopause, imagine what that is doing to your brain. Imagine. Now we're talking about consequences that are, I'm not saying that estrogen wouldn't help this lady at this point in time, but think about the suffering long term this has given this woman, her family, and her spouse. I mean, it's tragic. And it was all created by the way we have chosen to treat certain conditions rather than doing it naturally the way the body has been made and how we should approach the situation. So not only would you go on the pill for so many years. But at a certain point, then they're going to set you up for a huge failure by saying, let's just remove everything. Because,
Yeah.
surgical intervention is going to solve everything, especially if you have endometriosis and PCOS, and if you're having that just taking out your body parts.
That's the answer.
That's
I mean,
the answer.
that's the answer, because those body parts are only meant to have babies. So you don't really need them. I mean, why do you need your uterus? Why do you need your ovaries? Why do you need your cervix? You don't need it. It's just for having babies. So let's just get rid of it. And it'll cause you a lot less problems. Are you hearing this? How many people have heard that, right? Well, here's the analogy I want to give, and I'm going to be kind of a smart aleck about it. Well, a man's testes and a man's scrotum and a man's penis, they kind of are used for making babies and having sex and making babies. But when's the last time we say we're going to cut off a man's testicles and cut off his scrotum? And, they're just made for making babies. You don't need those. That would be never. There are certain instances when we did that years ago, castrated men because of prostate cancer. That's another horrible subject. And obviously it didn't work. But besides making men sterile and castrating them and making them not men, didn't really prevent the prostate problems. So anyway, that's a whole nother story for a whole nother podcast. But we don't cut out men's body parts when they're done having children. So, don't do it for women. So let's go into some alternatives. So if you are looking at birth control, then what are some alternatives? First of all, most of the women that Janet and I get are, because we take care of hormones at Mosley Professional Pharmacy, most of the women that we get are in their 40s or 50s. That's our typical patient. So the first question we ask is, do you have kids? And, if the answer is yes, then we say, okay, are you in a monogamous relationship? Yes, I've been married for 30 years. Okay, this is an easy one. Your husband needs to go get a vasectomy. Well, yeah, he doesn't want to. Then I tell them, okay, that's fine. Then you just tell him that you're going to cut him off and you're not going to have sex with him. And then maybe he'll go get a vasectomy. And I mean that seriously. Guys, buck up, get the vasectomy. It's an outpatient procedure. It literally takes 15 or 20 minutes. It's not that invasive. It's not that difficult a procedure. The other options for women, what they will give them is a hysterectomy, because you can't have kids anymore, or they'll have a tubal ligation. A tubal ligation is much more invasive than a vasectomy. Men, don't make your wives get a tubal ligation. Get a vasectomy. That's the simplest answer for somebody that's in a long-term relationship, doesn't want to have any more kids. Yeah, what are some other options?
Well, we've probably made the science a little bit easier, or the way to practice it, but there is still the rhythm method, which is still very doable
And effective.
And right. And there's still things called condoms. So, understanding your body cycle for women, I think, is something that we should be taught very early in life and learn how to utilize that, because it's certainly very helpful becoming pregnant or not becoming pregnant. And there are providers out there that know about this. Imagine that. It's been around for a long time. It's safe. It's not going to, interfere with your body's processes. Actually, it's probably going to make you understand how your body and your rhythm of your own body is. And, we act like that is so archaic, but it's really not. And it's super safe. The side effect is, well, if you are in a relationship and you are in the scenario that Shawn and I were discussing and you became pregnant, well, you're still in a good place, right? So there's that. Condoms are still effective. They're not going to give you osteoporosis and Alzheimer's, and you still have body parts intact.
And on the rhythm method, there's like Janet was saying, there's doctors that specialize in that. It's called the Creighton method,
Mhm.
Creihton, or NAPRO technology, NAPRO technology. Look them up. They specialize in that. And actually, the one of the things I like about the rhythm method is, like Janet says, it really, it makes a woman and their significant other get in tune with their body, because it's important to know about your cycles. And here's one of the reasons why. Gee, I realize now, every time, when I am about ready to cycle, I have headaches. Well, you don't lack a drug
Yeah.
for, your headache, Imitrex or whatever the latest drug is for headaches. You probably have some hormonal issues going on. So realize that there's a lot of things that you can do to affect those, to change that outcome. So when you know your cycle. So look up NAPRO technology or Creighton technology if you're interested in that. It's very, very effective and good to get in tune with your body. Um, some other methods also would be, which would also be a barrier method, which a condom is a
Copper.
barrier method, would be a diaphragm.
Mhm.
Diaphragms are very effective. They got to be sized by a doctor and then inserted in above your cervix. Um, Very effective method. That's non-hormonal. Another one would be a copper IUD. You want to talk about copper IUD, Janet?
Well, just the biggest thing for me is that they get confused a lot with current hormonal. So you need to be specific that you want the copper one in particular, because the Marina and the other ones that are out there, you don't want that.
And what a copper IUD does is it releases a little bit of copper um, near the uterus, so it makes it almost impossible for a sperm to implant or an egg to implant on the uterus, because it makes it another a really good environment. So I don't like that idea necessarily, because it is kind of screwing some tissue, but it's definitely better than hormonal birth control. Um, and let's see. So what else are we missing, Janet, when it comes to other means of contraception?
Restraint.
I, yeah, right.
I mean,
That would be
it's kind of, yeah,
abstinence.
right. And really, we laugh about this, and we act like the only thing that we can do is the chemical interventions. Um, but if you do choose this other method of what we are discussing today, just be forewarned there are consequences, and I think that's why we talk about this, because one of the consequences that I paid for, and I wish I would have never went down that route, is I started having bone issues really early, mid 30s. And then when I did become pregnant, I had issues with fibroids, which
Uterine fibroids,
uterine
right?
fibroids, right. And during the pregnancy, that was an ongoing issue, which women don't realize that these birth control pills as synthetic estrogens actually feed fibroids, which is not a healthy thing. So if you're having tissue growing inside your uterus the same time you're pregnant, that can be a huge issue. So you don't want that, and you don't think about that because it's not something, you don't pull out package inserts. You just go, oh, I went to my doctor. My doctor took care of it, and they told me it was safe and effective.
Well, and just, on the typical progression of what we've been discussing. So our second son was born C-section. That's a whole nother story, scheduled C-section, because VBACs are so dangerous. Don't get me started. Um, and there were a lot of uterine fibroids. So they had to cut through a lot of uterine fibroids. And of course, when Janet was under, and of course they asked me, they said, well, if you guys aren't going to have any more kids, we can just give her a hysterectomy now. I'm not kidding. We can just take her uterus out now, because that's the problem. It's like, no, well, we kind of like having her body parts intact. So we didn't take her uterus out. But how many women would say, yes, yeah, let's just take it out? And mind you that not only is there's some consequences of hormone issues, even if they leave the ovaries. But when you take a body part out, like your uterus, there is other things that your uterus does. You literally got a void in your body now. So now your bladder falls out, and you have all these prolapses, and body parts start floating around in your system. The uterus was holding that stuff up. Then all of a sudden women have urinary incontinence and they're peeing their pants and having all these issues. And it's like, yeah, that's the consequences of a hysterectomy. Even if they do, because they realize how bad it was taking people's ovaries out. So people caught on to that one. So let's keep your ovaries, but we'll take your uterus out. Oh, okay. Yeah, and then make a big void and cause all kinds of other problems. No, thank you. So anyway, I do want to comment on this also. We talk about these methods not being 100% as far as, the rhythm method and so on. But guess what? Neither are birth control pills. And my first son was born while Janet got pregnant while she was on the birth control pill with my first son. So birth control pills are not 100%. So, make sure you keep that in mind anytime that you are having sex with somebody that you might not want to have a child with. What else do you want to talk about on this one?
Well, I mean, I feel like our whole discussion is brought on because we see the consequences. Not everybody sees them immediately. So, there might be some people out there going, well, that's not my problem. Well, I didn't realize I had fibroids. I didn't realize that there was things that were happening to me. And the reason I feel so passionate about this is because my generation of ladies that went from high school to college, they've probably been on synthetic hormones for a long time, 30 or 40 years. So the consequences of this is just starting. Like we are just seeing the impact that is
long-term
right?
impact. Yeah.
So I am not going to be surprised. And even statistically, when you look at the numbers today, we are 48th in the world as far as women's health and longevity. And right now, when we look at the political forefront and the stories that are coming out, I'm not saying that we aren't hitting on some important topics, but it isn't just our food source that is getting us the issues. It's also what other things that we've put in our body, such as pharmaceuticals. And for women, at least my age, I totally believe that a lot of it has been we started on the birth control pill and then we've added all these other things, and the consequences are going to be playing out here, and they are devastating. It's not just
osteoporosis, cardiovascular disease, dementia. All
Right.
these things can be side effects from long-term consequences of having hormone deprivation in your early years.
And even as we age too, I mean, we actually have a lady who works for us who used to be an EMT. And we will ask her during our staff meetings to talk about some of the things that she's experienced. And, it's sad to listen to the real life story play out and what happens. And it's also sad for me to hear my patients that have, I've cared for over the years, and they were treated inappropriately, or they did exactly what they were taught by their prescriber, and they fall out of bed and crack their spine. Folks, that's not normal, right? And if you shatter a hip or crack a spine, life's not going to go well. And it can be very short, and it can be very painful and extreme. And the human suffering that happens along this way is devastating. I mean, like I'm talking about one of my friends today whose mother's, dealing with Alzheimer's and dementia. Folks, it shouldn't be like that for this lady. This should be the time that she's going to see, a grandchild or a great grandchild, or she should be enjoying retirement with her husband. Instead, she's being locked up because her brain is in a, dementia state or Alzheimer's state, and she's suffering. Her whole family's suffering. And it was all induced by the hormone deprivation throughout time and all the other consequences. And she did everything her doctor in her life she thought she was doing right. Like she listened to the medical advice. And folks, I don't want anybody else to be like that. I mean, it's just sad. So, these alternatives that we talk about, like natural hormones, wouldn't put this person in that position, whether it be their bones or their brain. And we could go down the line of cardiac. So it's a real thing that we see that plays out in our society. And one of the other things too, I mean, getting back into not maybe pharmaceuticals, is if we look at places where, um, like Hong Kong and Japan, that women are living longer, it's not because they aren't at risk for osteoporosis or bone health. It's partly because they're on less medications. Their lifestyle is different as far as eating and exercise. So all those things play together in conjunction. And folks, if you are going down the path of one more drug after the other, you need to stop and say, where does this end? How does this improve my health? And, for us, I think in my generation, the first door that opened was the pill and the birth control pill. And that was the first thing that I saw in pharmacy school that was a regular or pharmacy practice. Is that was the first thing that was like a monthly thing that people would come in for. It was rare that you saw other medications being dispensed that frequently.
Yeah, we've really just been pharmaceutical to death, literally, in this country, and the answer is usually not pharmaceuticals. Anytime you're having some kind of problem, the answer is usually a lifestyle change. So that's kind of off the subject of birth control pills, but it's really not,
It's on the
because
same
it really is all on the same
page.
Page. So, well, we're gonna wrap this podcast up, and I appreciate you guys listening to us. Please share this. Please comment. Please let us know what other subjects you'd like to hear. Go to our YouTube channel, the Moses Lake Professional Pharmacy YouTube channel, and go into our playlists and look at our Women's Health series and subscribe to it so you don't miss any episodes on our Women's Health series. We've just released episode 3. There's a total of 10 episodes, so you don't want to miss any of those. So thank you for listening to Health Solutions with Shawn and Janet Needham. Tune in to our regularly scheduled podcast Monday, 12:30 to 1:30 Pacific Standard Time. Thank you for listening.